everyone. It is a pleasure to have you with us. I am Onyinye Ukebo, the Legal Business Manager at Business Day. Thank you for joining us in this installment of our Digital Conversations. The Digital Conversations is an initiative of Business Day Legal Business, where we aim to interact with and dissect topical issues in the legal sector. This particular session forms part of our ongoing collaboration with the Nigerian Bar Association Section on Business Law, Employment, Labor and Industrial Relations Committee. In past sessions, we have discussed remote working as the new normal, mental health in the workplace, and our last segment was on the conversations with CEOs from the perspective of both the employers and the employees. Recaps are available on the Business Day YouTube page. At this time, I would like to hand over to Mr. Okweku, lead partner, the Law Press LLP, and chairman, NBA SBL ELIR Committee, to share a bit more about the committee. Thank you. Mr. Okweku.
Thank you, Onyinye. Welcome everyone who's found time to join us today. And we'd like to always say a big thank you to Onyinye and Business Day for the platform that enables us to have some of these very important conversations. And nothing could be more important as at today than the pandemic and the coronavirus. And as we begin to open up the economy again, I'll begin to go back to work. It brings on top of the burner, to the top burner, the issues around the role of vaccines in stemming the tide of the pandemic. And then when you talk about vaccines as well, you also will have to balance that out with the rights of employees as well as health and safety issues. And all will form part of the conversation we'll have today. And as usual, the SBL is on the forefront of driving knowledge and capacity building. And that's part of why we are here today. And so we have with us very excellent lawyers, human resource experts, and professors of medicine who will have to sit down and drill down this very interesting topic. I expect this to be very, very engaging. And at the end of the day, we'll probably learn one or two things about the vaccines and how this will impact on us going forward as a country, as individuals who work in the workplaces, and for those also who have underlying health problems. So on that note, I would like to welcome everyone once again, and thank you for taking time to join us. I will then hand over to my colleague, Wofaya Roberts, who will be moderating this session. Thank you once again for joining us.
Robert, you might want to unmute your mic. Mr. Roberts, please, you need to unmute your mic so that we can hear you. Wow.
Oh, can you hear me now?
Yes.
Can you all hear me now?
Yes.
Yes, we can hear you.
Sorry about that. So I was saying that as we already well know, sometime in December 2019, but that was the time that the first official communication or report of the virus was reported to the World Health Organization. World began its incursion into what would become the most devastating pandemic. But little did we even know at the time that what started as an insignificant ailment in the back corners of a not too popular Chinese city, that would become the harbinger of a much bigger, insurmountable global threat. So much has happened since that time that our lives have been changed by the revolutionary and evolutionary effect of the pandemic. But in a bid to stem the growing rate of the pandemic and provide solutions to the problem, some of the world's leading pharmaceutical organizations led the race. As of today, we have a number of vaccines. The World Health Organization reports that there are not less than 13 available variants of the vaccine produced across 4 or more leading areas, chiefly led by the likes of the Pfizer, AstraZeneca, Johnson & Johnson, and pharmaceutical organizations. But the issue that we continue to in fact face currently stems from the growing vaccine apathy among the growing number of concerned people around the world, and more particularly here in Nigeria, seeing that this conversation basically revolves around Nigeria's efforts so far in the vaccine race. Now, statistics have it that not less than 2% of the world's population has been vaccinated or otherwise inoculated. In the case of Nigeria, we only have a bare amount of 1,985,000 people who have been inoculated. Having regard to the large population that we have, Morocco and Seychelles continue to lead the vaccination exercise in Africa. Now, this predominant narrative, especially in developing countries in Africa, it's what would, what basically determines what we are discussing here today. This is the basis upon which we have been so called upon to discuss this issue. Employers who are more concerned by the seeming scourge of the virus and the refusal of employees to be inoculated have now introduced policies. Some employers, not all though, are considering policies aimed at compelling employees to take the virus. This is basically what our concern is. It is part of compelling employees to be vaccinated that has informed this present conversation. So what we will do is I would introduce our panelists, and then I would introduce and have one of our panelists, the representative of Professor Salako, who would give us an insight, a very brief insight into the nature of the virus and efforts that have been made so far to ensure that vaccination is administered to enable us to stem that tide. So in no particular order, I'll start by introducing our chief speaker who would headline this conversation today. We have with us the representative of Professor Babatunde Salako, who currently is the Director General of the Nigerian Institute of Medical Research. Professor Salako is a prestigious alumnus of the University College Ibadan, where he said it's an MBBS in 1986. He afterwards worked with the university, with the University Teaching Hospital, the University College Teaching Hospital in Ibadan, sometime in 1990, where he rose to become a consultant, and sometime in 1996. He currently, as I had said earlier, is the DG of the Nigerian Institute of Medical Research. Professor Salako is a nephrologist who has published and spoken on different platforms on the subject of virology and other very troubling or troublesome viruses raging the world. And so Professor Salako would headline this. He has so many awards, chief of which is the award which he received from the Royal College of Physicians of London in May 2016, amongst others. Secondly, we have Olumide Babalola. Olumide Babalola is a lawyer and the managing partner of LP. Olumide is many things, but of all the things that Olumide is, one thing that we so have come to recognize him with is that Olumide is perhaps arguably the most popular public interest lawyer in Nigeria. He has been involved in so many public interest cases involving crime, cyber crimes, hate speech, freedom of information, online freedom of expression, passage of laws protecting digital rights, and the likes. Lude is also a publisher. He has published about 5 books to his credit and continues to do so. He has represented and taken up very, very notable litigations, especially against governments, where he had, to a certain extent, succeeded in obtaining decisions from even the Supreme Court against several government organizations and agencies. Our next panelist is Chuma. Mr. Chuma, who currently is the chairman of the Nigeria Employers Consultative Association's Technical Committee on Human Resources Experts. Chuma has over 20 years experience in human resources management, and having worked for that period spanning in several roles in various branches of his HR discipline in many multinational organizations. Chuma presently works in the global HR team of one of the leading container shipping groups known as Mediterranean Shipping Company, with their head office in Geneva. Chuma currently also chairs the Committee of Human Resources and Learning Experts of NECA by virtue of his position in the NECA Governing Council. He's also on the board of National Salaries, Incomes, and Wages Commission. So it's our chest when we say that Chuma is a leading HR expert and can provide some very expert traction on the conversation today. We have our last panelist, Mary Ekenezi, who is a managing associate in Udo Udoma and Bello Saget. She's a lawyer. She also is a managing associate in the firm's employment and corporate advisory team. She has been involved in multiple transactions across her practice areas, including mergers and acquisitions, investments, syndicated financing, and project transactions. She also advises target companies involved in mergers and acquisitions on issues relating to employment law. She was a member of the team that advised a certain borrower in connection with the syndicated financing construction of a rolling steel mill factory, and has participated in various financing transactions where the firm has advised lenders in connection with term loans. But chiefly, our takeaway is that Chuma is also a leading employment expert, and she would also provide experts. She would bear us with her expertise in that area. Now, to commence the conversation, we would like the representative of Professor Salako, would like to invite the representative who will take us briefly, as I had said, on the nature of the virus. If I might ask, I can't get the name of the representative of Salako. I apologize on behalf of Salako, who could not make it because he's presently chairing a presentation in the National Assembly. And so, sir, could you briefly run us through the nature of what we are dealing with? In other words, the COVID-19 virus, how infection is spread, preventive initiatives, and the vaccination efforts that have been made so far.
All right, thank you very much for having me. My name is Dr. David Oladele, and I'm a consultant public health physician, also a chief research fellow at NIMA, and it's my honor to be here to do this talk on behalf of Professor Babatunde Lawasalako, who is currently in Abuja. I will try to see how I can cover his lecture within a little time. Probably will skip to a lot of stuff. But I will be talking about the COVID-19 pandemic, the vaccine safety, and also to talk about some occupational health issue. Like the moderator rightly mentioned, we know that from December 2019, COVID-19 became an issue worldwide. It's believed to be a zoonotic infection, meaning infection of animal that came into human population. And as at 30th of January, it's been about 210 countries. That was when it was declared as a public health emergency of international concern by WHO. And it was named a pandemic as of 11th March. As of yesterday, over 173 million people have been confirmed infected, and we have over 3 million deaths globally. In Nigeria, the first case was in February last year, and as at yesterday, these are the number that we have: over 166,000 and over 2,000 deaths in the country. NCDC has been at the forefront, as well as the PTF that we follow very closely on TV to give recommendations on what we need to do to protect the country with regard to the COVID-19 pandemic. Now, just to give a snapshot, we had the first wave and second wave. The graph I'm showing us is experience from our drive-through at Nigerian Institute of Medical Research, which is the foremost medical research institute in Nigeria. We have a drive-through center during the COVID-19, still currently ongoing, which you could drive your car in, your sample will be collected, and you get a sample sent to you via email. And as at January this year, that's the peak of the second wave. The upper curve is the number of cases we tested and those who became positive. And thankfully, from then till now, we've seen progressive decline in number of cases tested and the positive rate. And we are praying that we do not have a third wave. Also, just to mention some of the things that NIMA has done from the beginning of the pandemic, we've been able to sequence the virus to show that it have close relation with the one from the UK and China. We've also been able to conduct what we call a seroprevalence study to find out in the population how many people have been exposed to the virus. This study was done between the first and second wave of the pandemic, and we could say just a little above 1 in 5 persons in Lagos and Enugu has been exposed as at then, and we have the lowest prevalence in Gombe and Nasarawa. This graph just shows the difference from people exposed in the rural and urban area. We have more in urban area compared to rural area, except in Gombe State where we have the rivers. And in Lagos State, of course, Agege has the highest exposure, about 37%. That's about 1 in 3, 3 in 10 people that were exposed. Now, talking about the vaccine, do we have capacity to develop vaccine globally and perhaps in Africa? About 60% of vaccine we have came from the industry, 13% for academia, and 21% from the partnership of academics and industry. And as from the WHO record, we have about 157 vaccine types, and they are different. They work through different means. We have the RNA vaccine like the Moderna and the Pfizer vaccine in the US. We have the DNA, we have the subunit, we have the viral vector, we have attenuated, inactivated, and other vaccine subtypes. And does Africa have the capacity to manufacture vaccine? Generally, the answer is no. Though there are 5 countries in Africa who could actually manufacture some vaccine, but not COVID vaccine. But most people can actually hand to do some kind of packaging of the vaccine, like what we call fill finish. That can happen in Egypt and South Africa. But Nigeria has not been able to do that. And just to quickly mention, we'll be asking this question: can Nigeria actually have our own vaccine? Can we produce our own vaccine? Nigeria has some medical research, as well as some other centers in Nigeria has been able to do something. But what we have done in NIMA, we have been able to express some recombinant plasmid that could be a potential vaccine. The RTG is currently going through preclinical studies, because before you can have a vaccine given, you test it first in animal. That's what the preclinical studies. And if it's shown to be safe in animal, efficacious, then we do phase 1 and phase 2 studies. Then after that, we go to phase 3 study. It's after it has been able to be evaluated in phase 3 study, clinical trial, that it can be used in the population. About all of the vaccine currently being used went through these stages before it is available to use generally. Just to show some of the diagram of what we are doing in the laboratory to test this candidate antigen in laboratory animal to see the efficacy and safety. Now, generally, the Global Alliance for Vaccine Immunization has been on the driver force to make vaccine available, particularly in developing countries, because we know that there are disparity between the rich country and Africa with access to vaccine. And Gavi through COVAX is trying to see how poor countries in the world can actually have access to this vaccine so that we can have it as a prevention method. And generally, just to give us an idea, as at 19th of April this year, over 792 million COVID-19 vaccine doses are being administered globally. And the top country with the higher percentage of coverage include Israel. Israel is at 61% of their population has received at least one dose of COVID-19 vaccine, followed by Bhutan, United Kingdom 47%, US 35%, and I'm sure no country in Africa actually come closer. And you know, Nigeria, we are only looking at healthcare worker and those above 65 years now. And there's been issues about vaccine safety. Is it safe? And there'll be a lot of talk around town and whether we can use vaccine to treat people. And just to let us know on this panel that before any COVID vaccine can be authorized for use, the manufacturer must have demonstrated that this vaccine is safe and effective. And tens of thousands of people across the world have received this vaccine during clinical trial, like I mentioned earlier on. And generally, the side effects have been reported, something mild like pain, tenderness, or injection site, fever, headache. And the fact that WHO has, which is the regulatory agency worldwide, has pre-qualified or given emergency use authorization for this vaccine show that they did not consider any serious adverse reaction to the vaccine, and it can be used. And we can see that in places like US, their trend of COVID-19 has actually gone down after the introduction and scale up of vaccine in that country. So like I already mentioned earlier on, there are many factors that has affected the uptake of the vaccine based on the perception of people on the safety of vaccine. There are a lot of myths and disinformation. Myth like the process of making this vaccine was rushed, because we know that traditionally it takes years to get vaccine out. But to say the truth, we have had advancement in science that make it possible to have this vaccine done. And a lot of clinical trials done, so that myth is not true. Second one is that people feel that if you have been vaccinated, you don't need to use the non-pharmaceutical intervention like a wearing face mask, maintaining social distancing. But we know that evidence has shown that vaccination will prevent people from getting sick, but they may still acquire or transmit the virus to others. So we still need to actually wear a mask. And that's the one that was making around with the myth around 5G that the vaccine could actually implant a microchip in whoever is taking this so that government can track. Sincerely speaking, there's no evidence to support this assertion. And these are some of the reasons why vaccine has not been that acceptable. But generally, all the vaccine that is available are deemed to be safe because they went through rigorous scientific production and experiment. And so far, even the first dose we give in Nigeria, there has not been any serious adverse events. We just have some mild vaccine-associated reaction. So just to talk a bit about COVID-19 and occupational health, because I get at the thrust of the discussion. The Employee Compensation Act 2010 said that occupational disease are disease that can be contacted in the workplace due to exposure to this factor. So because of this, we know that COVID-19 is spread through droplet infection when a worker stays close to another worker, co-worker who has symptoms of the disease can actually get infected. So we can safely say that COVID-19 can be contracted in the workplace and it qualifies to be an occupational health disease. And it is advisable for an employer to either employ or assign an employee or a team to keep a workplace safe. So workplace safety is very important with regards to COVID-19. And that we actually touch down on whether we need to make employee or employee to take vaccine when it's available or not. But we leave that discussion to the lawyers. But from occupational perspective, there's a need to make sure the workplace is safe for employee and for them to actually do what they need to do. So employer may therefore ask employee to provide personal, medical, and travel and related data to take pre-employment medical tests, especially in relation to COVID-19 infection. I know this might be a challenge in Nigeria because Nigerians can try to fabricate stories about where they've been, but we know that exposure to COVID-19 might not only occur in the workplace, it could also occur when they are moving around, attending parties during weekend and all the rest. But our employer must make sure that this is asked, so it will help in deciding on what to do. And employer need to actually comply with the guideline of NCDC with regard to staff who are diagnosed with COVID-19 with regard to treatment, and also to protect other staff. Employees need to request or insist on returning workers to undergo medical examination before resuming work. So this is why occupational health is very important with regard to diagnosis and making sure that the workplace is safe for the workers. So what would be the potential benefits of COVID-19 vaccine to the employers or to the employees. First, to the employers. It keeps the workplace healthy by preventing employees from getting the virus. It also reduces absence due to illness, because if they are all vaccinated, they are not likely to come and say they are sick, they couldn't come to work. It could improve productivity in the long run, and they also improve morale. For the employees, it prevents the illness, it reduces absence and doctor visit due to illness, and it could also improve morale. So giving COVID-19 in the workplace is a win-win for both the employers as well as the employee. And now, should the employer insist the employee obtain COVID-19 vaccine? If this will occur, it must be supported, I believe, strongly by legislation. There should be a policy at the workplace that we kind of speak to this. Otherwise, the employee might actually have a case against the employer. But I leave the discussion to the lawyers in the House who will talk more to it. Because of my time, I will like to say that there is a need to notify the authorities who will advise on further action should, in case any employee gets infected with COVID-19. I'm sure that the Lagos State government has mandated the use of face masks in public places from last year, April. And the workplace can be termed as a public place. Like in place where I work in our institute, it is mandatory that every staff wear face mask. But that is the least we could do to prevent transmission of infection in the workplace. So what are some best practices that employer can actually use talking about employee safety in the workplace and with regard to the vaccine? This is from CDC. The employer could offer a flexible and non-punitive sick leave option for employees who have signs of maybe symptoms after vaccination, because some could have some side effects. So, and just to make sure that you accommodate it at this level, then also to align time for vaccine confidence to grow. I think it's very critical because even among healthcare workers, there's some healthcare workers who do not want to take the vaccine for some of those things I've said earlier on, the infodemics, the misconception, the wrong information about the vaccine. So there's a need for employers to allow the vaccine confidence to grow, and workers who are hesitant at first may become more ready to take the vaccine after they've seen their co-worker get vaccinated, and encouraged to do that. So they could also ask organizations and individuals who are respected in the employee community to help to build this confidence, to talk about it, and so that you can have their confidence and they could take the vaccine, because like I showed us earlier on, COVID-19 vaccine in the workplace is a win-win for both the employer as well as the employee. So because of my time, I'm going to be ending it here. Thank you very much for having me.
Thank you very, very much, Professor Oladile, for that very concise but detailed presentation. Indeed, you have in fact heralded us into the discussion from an employer's perspective. You did say that employers may insist on employees taking the vaccines as a basis for continuing employment, even though you noted that it is not supported by legislation. But I would like to therefore have Mr. Chuma's weigh in on this, being the HR experts on this panel. So Mr. Chuma, perhaps you would like to know or know what the current best practice among employers regarding vaccination. What is the current best practice among employers regarding vaccination? Is there a current drive to compel vaccination, or rather your attempt at getting employees to be vaccinated is more or less one that encourages them to do so? And what's the Nigerian practice, your expertise in HR?
Okay, thanks, Wafai. I would like to first start, before addressing the question that you put across to me, I would like to say that the question of whether employers should make vaccination compulsory or not has been a recurring one. This question was there at the onset of the pandemic, and it was muted because there was no vaccine yet, which meant that it was premature to raise that question. But now that there are vaccines and vaccination programs, it is the right time to delve into it and address that. This question actually brings us right at the intersection of individual rights and public health. And I'm really happy to be part of a conversation that throws more light into the conversation. Now to the question. Let me say outrightly, but like the previous speaker has said, I'm sure the lawyers, we have enough lawyers on the panel and in the audience to deal with the legal aspects. But let me say upfront that there are no enabling laws and and regulations from any of the agencies of government that I'm aware of that directly empower the employer to make vaccination compulsory. However, if we're talking of best practice, employers have and are doing a lot already to encourage their employees to go for vaccination. I don't want to delve into the Employee Compensation Act. Maybe we'll get into that discussion a little bit more, at least from the employer's perspective, on whether it actually provides the enabling requirement, compulsion of vaccination or not. I am also aware of WHO and ILO, International Labour Organization, guidelines on how to make the workplace safe itself. But let's draw from some of the best practices. I'm not aware of any organization that is in 60, and I'm speaking outside of the healthcare workforce. I'm talking generally outside the healthcare workforce because there are issues as to what occupational disease is when you are talking of healthcare workers, which can be a little different from occupational disease when you are referring to other workers who are not healthcare professionals. But to hit directly at the point, the employers are encouraging their employees to go for vaccination, in improving vaccine confidence, which means enabling people and encouraging people to understand the science of it, the side effects, the safety precautions, the preclinical trials, and all the issues that we've listened to from the previous speaker. That is one part of that. And then there are other issues with showing leadership. The top people in the organization, making sure that they go for vaccination and talking about it when they are going for vaccination, when they come back, so that people can see for themselves that they have done that and they're still hale and hearty. And if anything, they have improved their chances and all our chances of returning back to normal life, which is what the vaccination helps to achieve. There are other things like ensuring that you create time for people to go for vaccination, giving information on where the vaccination centers are, helping people to keep track on a template of what of the date they took the first jab and the date when they're going to take the next and final jab for the 2 jab vaccines. So those are some of the things that a number of employers are already doing with their workforce or to encourage their workforce. But I am not aware, like I have said, that any employer that think it would be futile to insist, because then you delve into issues of fundamental human rights and so on for the meantime, because there are no enabling laws or regulations. So let me stop there in the meantime, and then we can come back to more details later.
Yes, thank you very, very much, Mr. Chuma. And you made a very, very interesting remark about the insistence of employers that their employees take the vaccine. You had said that perhaps what employers should do is, what employers do is that they encourage. If I might take you up on that, could you care to elucidate more on the nature of the encouragement that employers make or extend to their employees to get them to take the vaccine? I say this because I have had an engagement with quite a number of HR experts who have insisted that their company policy is that employees who are not inclined to take vaccination, or who are not inclined to be inoculated, are rather must be allowed to be excused from the organization. So that my question is that a sort of encouragement that you talk about emanating from employers, particularly from a very, very realistic and practical point of view?
Okay, the point is that encouragement is one thing, but also invoking the right to terminate the employment of an employee or a worker is clearly a different matter. I think that doesn't really arise or shouldn't really arise for the meantime. But all the safety protocols that are required for COVID-19 are being implemented in the workplaces, from hand sanitizing to nose masks and face shields, fumigation, social distancing, even scrubbing or wiping, sanitizing commonly touched surfaces. So many things are happening, but that doesn't include a mandatory vaccination program, as far as I know, as I keep saying. But employers have done quite a lot, and they are still doing quite a lot in terms of vaccination. Some have even gone to the extent of what can call hassle communication, meaning something pops up on your screen every 30 minutes to remind you to go for vaccination or to talk about what vaccination will do, the benefits of vaccination. The templates that I mentioned, some have even created incentives that those who have a copay system in their health management schemes can create a copay where they can provide some payments for some part of your payment for insurance if you are able to go and take the vaccine, because actually you are helping them to prevent the incidence of becoming ill, which turns out to be cheaper in the long term. So there are all kinds of things we can probably talk about in terms of what employers are doing, but it's important to keep emphasizing that it does not include compulsory vaccination. Yes, some people would need to travel on behalf of the business, and of course, if you're going to travel, some countries will require that you show a certificate that you have been vaccinated. So what's going to happen now? Are you going to travel as in the execution of the requirements of your responsibilities, or are you going to say, no, I'm not going to travel, which is a completely different discussion that we're going to have on whether you are fulfilling the responsibilities embedded in your contract. But I'll leave that there for now. Yes.
Oh, thank you. Thank you very much, Chuma, for that explanation. We haven't left the subject of insistent yet. We are still, because that basically is the most pressing of all the issues touching on vaccination. So, Mary, let me come to you, Mary. Flowing from our engagement with Mr. Chuma, do you think, is there currently any legal basis for insisting on vaccination? Or what possible justifications do you think, as a lawyer, for employers, that employers may premise the insistence on compulsory vaccination? Because I say this because whether or not we like it or not, Mr. Chuma has mentioned, and indeed, Prof has also said, that's Professor Ladili, has also talked about the need for vaccination and being premised on the fact that there is a very, very serious need to ensure that the health and safety of other people, not just the person who doesn't want to vaccinate willingly, is protected. So that at some point, there might be some form of push. I would rather not want to use the word compulsion. There might be some sort of push from the employer to help their employees accept vaccination. So, do you think, is there a way that we can justify an insistence on the part of the employer that employees be vaccinated?
This is a very interesting conversation, and it's one that happens in all organizations I'm aware of. Before I respond to your specific question, I do think that it's important to highlight some of the reasons why some persons should not want to take the vaccine. And I think it's important that these reasons are put on the table and it's weighed, because we're weighing public health, individual health, right to privacy, and all of that. these vaccines have been tested, but they are really, even by the WHO standards, really for emergency use. So there's ongoing reporting going on the vaccines, what happens, both the NAFDAC regulations and the WHO directives on this requires that. There are, I mean, everybody's really glued to the TV and listening to news. They're getting reports of what's happening, there are adverse reactions. There is also the fact that whoever takes this vaccine is safe. And so the only person really at risk is the person who hasn't taken the vaccine. The safety measures that we have taken, and again, I like to look at the numbers in Nigeria. So, I mean, I know in other countries it's terrible, right? As of June 8, 2021, which is yesterday, we had just under 3,000 deaths. So we've had this pandemic for more than a year, and we have just 3,000 deaths nationwide. I'm not saying that number is small. I'm not, undermining those out there. I'm just saying I'm putting the risk in context. It's 3,000 deaths in over 1 year. We lose more than that to malaria. We lose more than that to every other sickness. That, and I'm not the expert, I would like the experts to weigh in, suggests to me that we do have some measure of herd immunity growing in this community. And so if we place all of that, then certainly if someone doesn't want to take the vaccine, I'm not quite sure how they are at risk, because the only person at risk is the person who has said, I don't want to take the vaccine. So the employer may then say, well, if you don't take the vaccine, I won't take responsibility, get an employee to sign off. And I mean, I'm not sure that's a problem. So I guess that I'm thinking that even from a health perspective, there are several factors in Nigeria as we speak today that suggest that we may not necessarily be on the same level as other countries. And so my question is, why are we not taking that into cognizance? But back to your question, what can an employer do? Is there any reason why an employer might say, I want you to take the vaccine? Usually what I have seen in contracts of employment is a contractual obligation. Some contracts, not all contracts, where the employer reserves the right and the employee agrees to submit to such medical tests or medical exams as may be required to enable the so that the employer just checks that you're in a good place. Following the onset of the vaccines, I've seen new contracts where they're actually expressly indicating that they were required to take vaccines, understandably so. But, and so, yeah, there's a contractual obligation, but you have to also juxtapose that against the fact that under the National Health Act, ultimately it's the employee who has to consent to doing what they want to do. They have the right to decide. I've listened to all of the explanation. I would rather not throw this part. I suppose that my view is to the extent that the employees really pose the risk to themselves, because those who've been vaccinated are fine. I think that employers can get around compulsory vaccination by asking employees who do not, for whatever reason, and there are various reasons, some for religious reasons actually are refusing to take this, and we have to respect their freedom of conscience also, to undertake that, look, we won't take responsibility for you because you haven't taken the steps. But again, as long as we continue to maintain all the safety protocols, wash our hands, use clean the place surfaces regularly, social wear the face masks, I think we're fine. And I think that we can continue to exist. In any event, our economy has been opening up, and in particular, the informal economy has opened up a lot more than we have. And we're not seeing high rise, like a spike really, either in the number of people who contract the virus, or even a number of deaths.
Oh, thank you very much, Mary. So 2 points you have made. That employers can get around really insisting that employees be vaccinated, because the only person at risk is the person who refuses to take the vaccine. So, in other words, persons who take the vaccines are safe. That brings me to a question I would love to ask. Perhaps we should hold that thought there. I'll come back to that. The second point that you have made, Mary, is that the person who ordinarily ought to take the vaccine, after listening to all the reasons why it is necessary that he be inoculated, still holds the ace over whether or not he should be, or he or she should be vaccinated. That point simply means that the employee has a right, whether or not he wants to take the vaccine. Now, this brings me to the question I would like to ask Olumide. So could you take us, is that a fundamental rights perspective, this whole vaccination problem? What's the perspective from a fundamental rights point of view? As Mary had pointed out, that the employee holds the ace, he holds the final say whether or not they want to be vaccinated. So looking at it from a rights perspective, is there a right of choice whether or not to be vaccinated?
Thank you very much for the invitation. Thank you for this point. I'm not sure there's any other issue as important as this right now, especially in the workspace. So answering your question, I would first of all go to WHO's website, where they have discussed the vaccine and the frequent questions that people ask about it. First, on their website, they said it is safe for most people, not all. That means some people eat and they might not be safe. Then, secondly, they said it develops immunity. Thirdly, they said it protects the person from getting seriously ill. So meaning it is the person who is vaccinated that is protected, not even the second person, not even the third person. Then on their website, and this is very scary, WHO openly declares that they still do not know the extent to which the vaccine keeps people away from being infected or passing the virus. So what is the point? So, okay, the world does not know whether it keeps you from being safe, whether it makes you safe, or whether it keeps the other person from being infected. Then every discussion will start from there. Now, talking about the rights it violates. First of all, it violates or it interferes. Let me not use the word violates because that word is very critical. It interferes with the right to life. Reuters, BBC reported the number of people who died after taking the vaccine. I understand Reuters reported that about 4,137 died in the US for taking between December and May 2021 after taking the vaccine. Now, 3 deaths were recorded in Scotland, May, by BBC. Elderly patients all over the world are susceptible. I have a personal experience of a friend whose mother-in-law took it and she died as a result of the vaccine. Off record, I know Lagos is trying to maybe conduct autopsy, but the woman is dead, so that's. So I even have to tell my own aged relatives not to just stay clear right now. Let's see how it goes. So all of us are still speculating on how safe this thing truly is, how safe it is, or how dangerous it is. So I'm not sure. So something that can possibly interfere with people's lives. So we know, yes, it has a fundamental right implication. Then what about privacy? The Supreme Court in the decision with the Medical and Dental Council and Okonfo says that the right to privacy implies the right to protect your body from unauthorized invasion. So we also understand that, yes, it has some privacy implications. I'm not sure. So there are speculations that when you take it, Prof said is a myth that there's a chip or that you could react to it in any way. Nobody knows how one will react to it. I've listened to some senior lawyers who took it, and for 3 days, for 5 days, they were knocked out. So we all don't know these things. It is still in its experimental stage. But for anybody who wishes to be a guinea pig, I think it should be a personal right to privacy has been defined as personal autonomy. So I should be able to decide whether or not I want to take it. And I should not be compelled because it's a matter of fundamental human rights. Now, let's even now assume a law is passed let's assume right now everybody knows no law, so you can't even compare because there is no law compelling it. That there are no legal implications whether you want to take or not. So no employer under any guise. I understand in the US, employers are begging, they are cajoling employees to take it. So if you find some internal measures to cajole employees to take it, just maybe, but compelling, the word compulsion should not even come into place at all. Let's assume a law is passed and maybe at the national level, we had that discussion in one of the platforms, although that's a conversation I really don't want to go into. But until we get to that spot where a law is passed, I'm not sure any government wants to take that lead now. For what we are not all sure, for what the World Health Organization is not sure about, we now want to pass a law and we must begin to take it. I really don't think anybody can compare. I wouldn't want to take much of our time, but we understand this compulsion interferes with two basic rights without even talking about dignity of human persons here. But let's look at what if somebody takes it and dies? What are we going to say? Or what somebody takes it and begins to misbehave? Because even on World Health Organization, their website, that if you react to certain things, you're advised not to even take the vaccine. So we understand this thing has so many implications for the health. And for some people, for their thoughts too. Some people go to churches or they worship, they have religions that do not permit them to take some of these things. So it has so many implications. But until we get there as a nation, or even in the world now, no country has done that yet. So for me, I think it has serious health, privacy and human rights implications. And I don't think anybody right now on the state of our laws can compel the taking of the vaccine. Thank you.
Thank you very, very much, Olumide. I don't know if I can put you on the spot. I know you said that. I know you said earlier that you would like to state off record. But it's interesting that we are, on an international platform. It's already taken this. But can I put you on the spot, Olumide? Have you been vaccinated?
No, I haven't. So what the family decision I made is because nobody knows. So the question my wife asked me was so right now, because if you check WHO's website, it is at some point last year. I'm so sure, but not that I tested positive, but a whole lot of us had some malaria symptoms, some funny symptoms like that, and you just want to suspect the virus. But for some people, their immunity have been able to fight it, and they didn't have to go to the hospital or anything. So the question I ask myself is, I am not sick yet. Why would I go and take a vaccine that will make me sick? So I've seen people who were knocked out for days because they took the vaccine. Yes, it boosts your immunity, but WHO says it wears off. So you take it, you take the first dose, you take the second dose, and we even understand maybe we begin to take it annually every year until so everybody is still not sure. So I'm not sure I also want to take that risk right now. But just like we keep saying, if it becomes a matter of law, or if I can't travel, I take it, of course, I might be compelled. But in the workplace, I think it's a very, very big risk for even employers to take. What if you compel an employee to take it and it goes wrong? Of course, the employer will seriously be liable in such cases. So the moment you tell me that it does not stop my colleague from contracting the virus, that they still have to take the precautions, then what am I taking it for? For myself. Then I said, if it is just for me, just leave me the way I am. I don't want to be protected. If it is just for me, if it's not for my colleague, if it's not for my neighbors, then just leave me. So long it doesn't stop every other person from contracting it, then what are we talking about? I haven't taken it yet, but maybe I'll take it. I'm not sure. But my employers would not be compelling me to take it.
Thank you very much for your honesty. So there's a table shaking question playing in my head. I would not ask it. The thoughts playing in my head is, would it not seem hypocritical that you would insist on persons traveling so as a matter of necessity be compelled to take the vaccine, yet we do not consider that it is necessary that some persons may, as a matter of compulsion as well, be made to take the vaccines in order to secure others in their organization. It's just a thought too. Now, Mary had said earlier that perhaps the only person who is at risk virus at the workplace is the person who has refused to take the vaccine, because the person who has taken the vaccine basically or primarily is already protected and transmit. So this brings me to a question I've been meaning to ask Prof. So Professor Salako, Professor Ladele, can I ask, do vaccines actually cure the infection? And as a follow-up, how safe are we from infection after vaccination? Does it also mean that the person who has taken the vaccine cannot transmit same?
All right. Can you hear me?
Yes, I can. Yes.
Oh, great. Thank you. I've actually enjoyed the discussion from all the discussants so far. Just maybe before I come to just to mention some of the things, a little, my comments on some of the things that have been raised. With regard to WHO statement of not being sure of whether vaccine is safe and what they wrote, I just want to drop it here that WHO work on what we call evidence-based medicine. And they can only come and make a categorical statement when they've had many clinical trials on any disease entity, might not be COVID-19. And they now put together evidence from those clinical trials to say that, okay, from this available evidence, this is what we can say. Until they get to that level, they don't talk in absolute. We don't talk about healthcare in absolute. That's why that statement is in that website, that we are not sure of what will happen. But when we have an emergency like this, that we've not seen in over 100 years, should we sit down and fold our hands without doing anything to their sides? No. So should we divulge or use science to solve this problem? The answer is yes. And that is why countries are doing their best to actually see how this vaccine can be mainstream to help. And does vaccine help to prevent infection? Yes. You can monitor the rate of infection in the US. It's going down when they have a kind of more decisive approach to what the COVID-19 control and the scale up of the vaccine. So that's just by the way. And also there was an issue raised by the barrister on herd immunity. In fact, one of the study we did, the seroprevalence study that we did at NIMA last year, was actually to find out whether we have herd immunity in the community. And that is looking at how many people actually have antibody to the virus in the community. And from what I presented earlier on, it's just about 1 in 5, at best 1 in 4. And until you have herd immunity that has reached between 60 and 70%, you cannot talk about the fact, until you have antibody in the community that's up to 60 to 70%, you can't talk about herd immunity. So we're still far from it. But thankfully, I think just God provident that we've not had severe disease in this part of the world. Now, COVID-19 is peculiar in that, fine, the death to COVID-19 is not as much as malaria and other diseases, but malaria only affects under 5. The severe malaria and death is among under 5 years old and pregnant women. But COVID-19 death is mostly among the productive age group. That's why something must be done about it. And that's why the vaccine issue is very, very critical. Okay, so I just want to drop that. Now, back to your question that does it really prevent disease? From the clinical trials done, it's been said that when many people have been vaccinated, you reduce the chance of getting the infection, like the barrister said, at the workplace or in the community. And we see the trend in places where they'll be able to scale up their vaccine. Okay, and even if when they get infected, it prevents severe disease. So not that we don't have COVID-19 in Nigeria, but most people see it as mild disease, mild headache, malaise, some malaria-like symptoms. But because it's not the severe disease, and we know from the spectrum that 95% of those who are infected will not have severe disease. And among those who have severe disease, it's only those who have pre-existing medical condition. The people that have heart condition, diabetes, obesity, that are more likely, or those who have smoked cigarettes, who have a chronic obstructive pulmonary disease, where their lung has been compromised, they are likely to die from the disease. So all these things, we need to put them into consideration in deciding who should be vaccinated. So I think that is what I want to say about that. I hope I answer your question.
Well, yes, in a sense, yes. Yeah. I'm going to come to Mr. Chuma. I seem to think that from Olumide's perspective on the issue, and it would appear that there is a certain concurrence between his thoughts and that of Mary. And what this says to us is that there's going to be possible challenges that employers are possibly going to have from the refusal of employees to, perhaps in order to better elucidate this, I would like to have Mary's thoughts on an issue following his exposition. The fact that he said he's not inclined to taking the vaccine and he does not think that anybody should, in fact, be inclined to do so. The question is, can employees lawfully, I mean, those who, because Prof has actually clarified that the vaccine in itself, the current vaccines that we have are not curative in nature. So after a certain period, these vaccines wear off. So can employees lawfully refuse, in fact, to go to work or even absent themselves from work if co-workers are not vaccinated or refuse to be vaccinated? Now, following this also, what happens if an employee gets infected by the virus by the non-insistence of an employer that his employees be vaccinated? I don't know if you got the questions, Mary.
Yes, I did. I got your question. So, I mean, the second question, my understanding is, what happens where an employee is infected with the virus because another employee has failed to take the virus, has failed to take the vaccine?
Oh, yes.
Okay. So before I answer the question, I want to piggyback on what the professor had said.
Oladele said, yes.
Professor Oladele. Now, who are those most at risk? And I'm emphasizing this because, again, the concern for us as a nation, and as business employees and as employers, I want the economy back in full. Who are those most at risk? People who have underlying conditions, old people, those with chronic respiratory disease. Even the professor himself has said to us that many people, had symptoms generally, but, they were not really ill. So if the focus is on the people who are most at risk, that takes a significant number of employees out of the bucket. And if that is the case, then I'm not quite sure why it's compulsory, because most people will have COVID. I have colleagues who've had COVID. They've recovered, no vaccine, they're perfectly fine. So as they had the COVID and they've recovered, do they have antibodies? If they don't have antibodies, why is that the case? These are the questions. So it's not entirely an employee-employee question. You're looking at an experimental. I was looking at the FDA statement on this. It's only for emergency use. It means it's experimental. They haven't quite said it's perfect. So there is a risk that something may go wrong. And when the vaccines were being developed, I was following the conversations. All of the manufacturers, all without exception, have exemption from liability. So something goes wrong, you're your own. Now, if you take all of these issues and put them together, and then weigh the fact, again, I situate it back to Nigeria, we've had only less than 3,000 deaths in 1 year. I am not saying that those deaths are not terrible. I'm just saying that in context, in a country of 200 million people, put that number in context, and then weigh it against the risk of a vaccine that is experimental, that we don't quite know what's going to happen. And we are seeing reports from other nations, people have died, people have sicknesses that they can't explain. Almost everybody who's taking this vaccine I'm aware of has some sort of reaction. It begs the question. I don't know that even someone who comes into the office and gets this can categorically say, I got it because you've not been vaccinated. Because somebody who's been vaccinated, from what I'm reading on the common questions and answers, even says that people who are vaccinated can still transmit it. So if I've been vaccinated, I can transmit it. It doesn't make a difference then. I can't blame anybody. If I have been vaccinated and I can give it to someone who has not been vaccinated, again, back to my initial argument, the only person at risk, properly speaking, is the person who's taking the vaccine. And the person who's saying, I don't want to take the vaccine, has looked at all of the circumstances and said, you know what, I'll pass on this vaccine. So, and that my solution for that for employers, because again, business has to continue, is if employees do not want to take these vaccines, then get them to agree that you won't be liable because the vaccine provides some medical protection and they're willing not to go with it. So I'm not even sure that the employee who has signed up for the document will have a basis because it's clear that even those who have been vaccinated can still transmit it. So it begs the question of why is this vaccine mandatory?
Thank you, Mary. Thank you. One very key point, one key thing you have certified. If employees continue to express a disinclination to take the vaccine, get the employers to have the employees sign an undertaking that the employer will not be liable. So this primarily simply means that there's a whole lot of headaches that the employers have had to grapple with. So I come back to you with Chuma. If you can help us, what possible challenges do you say the employers are perhaps currently having or will have in the future from anti-vaxxers generally?
Ofai, can you repeat the last part of your question?
Yeah, so my question is, in view of what Mary has said, I mean, there's an indication that employers are really, truly going through headaches. On the one hand, the employer perhaps would need to consider the safety of its employees, and on the other hand, he's probably considering a very headstrong employee whom he feels is likely to jeopardize the business of that organization. So I ask, what possible challenges do you envisage employers are currently having with anti-vaxxers? By the way, anti-vaxxers, I mean, are people who are disinclined to vaccination. And what possible challenges do you envisage employers are currently having or will have in the future?
Okay, I think this is an interesting question. And let me start with the one you dropped before Mary responded, which is the issue of can the employer be said to be negligent if an employee picks up an infection simply because certain things were not done in the workplace to make sure that it doesn't pick that up from another employee. So I think that's a veritable challenge to start with already. Now, the point is that if I take the Employee Compensation Act itself, which primarily tries to ensure an open and fair, an open and guaranteed compensation when there is death or disability or disease or injury arising out of and in the course of employment. Many people would easily have said, look, by the act itself, the employer has a responsibility to provide a safe working environment, and the pandemic would easily qualify as an occupational disease. I beg to differ slightly. If you look at the Employee Compensation Act, it is the nature of the employment. It is diseases that are coming out of the nature of the employment. So typically, if an employee is working in a furniture company and he inhales dust, wood dust, or chemicals that are used for treating wood, he inhales the fumes. So over time, he develops a respiratory disease. This would easily qualify as occupational disease because you can see that it's arising out of and in the course of employment. But the pandemic is a little different because you can pick it up from anywhere, as some of us have rightly mentioned. It's not necessarily arising because you report in an office and all, even though you could pick up from another employee. But I think what has generated some of the discussion as to the fact that the employer has to provide a safe working environment is that the WHO ILO guidelines, which many countries have adopted, and you can see that in our NCDC guidelines as well, is that it asks employers to combine the normal precautions they take for mental and physical well-being of employees when it comes to occupational disease, to combine all of that with the COVID protocols. I think that might be causing the confusion in thinking immediately that, look, this is an occupational disease. For those healthcare workers, it's easily an occupational disease, of course. But for others, it's not so clear. And you need to always look at the case closely to say, yes, is this an occupational disease or not? Why am I taking time to delve into this? It's because it has a lot of implications for how far the employer should go in providing a safe work environment and all that. I think that directly speaking to this issue, if an employer goes through all the protocols that are with the COVID protocols, I think sufficiently at this point, you could say that they have taken all the precautions to make sure that the environment, the work itself and the work environment, the workplace is safe for other employees. These are some of the things that employers are trying to sort out. Some would have to review their policies again. Mary has rightly pointed out the contract of employment. Many of them did not envisage the pandemic, and there are no clauses in the contract of employment to do even basic things like remote working and a number of things in the event of a pandemic. But there are several issues that employers are looking at from the point of view of negligence. How far can we go to make sure that there is no prevalence of infections in the workplace by going through the protocols that I have mentioned? I think once you've done that, and because there are no enabling laws in state, you can make vaccination compulsory. You don't have to make vaccination compulsory, but go through all these protocols as an employer. And I think you would have taken care of one aspect of a possible negligence for the employer. The other issue is the contract of employment. It's time to begin to review that and look at that again, because if, for instance, the contract of employment says that in the event of a pandemic, the company may, out of necessity, require the inoculation of all employees. And on such an occasion, we would expect you to comply. If there's a clause like that in the contract of employment, maybe it helps the employer begin to take care of specific employees that will have to do their jobs and will be necessary for them to take the vaccine, so that at that point you can begin to cross that line a little bit on the right to consent to medical treatment, which is an individual right that is enshrined in the Public Health Act, itself. But these are some of the things that employers should begin to look at now. Issues of remote working and what are the guidelines for remote working, because you may need people to work from their homes and still be productive, so that they can at least be assured that they don't have to be at the workplace in case they should pick up the COVID virus infection. So a lot of policies, it's an opportunity for employers to begin to look at a lot of policies that did not envisage such a pandemic or outbreak. Let me stop there for now. Yeah.
Thank you very, very much. That's really a very, very interesting angle. Just to say that we will soon take participants. So both Mary and Chuma have talked a lot about the contract of employment, so that perhaps one way that the employer may be able to deal with the issues or the challenges that we faced from employees who are not inclined to be vaccinated is perhaps to look at the contract again. As Mary had said earlier, maybe a contract which secures or prevents the employer from bearing liability for any vaccination of employees, perhaps could be apt. So Olu, I want to ask, because sometime, I think it was sometime in January this year, and that phrase has become very, very popular. A certain UK company became very popular for a certain phrase that they introduced in the workplace, and they made comments, no job, no job. And the company felt that it was quite necessary that in order to protect the employees and protect the organizations, it would be quite apt or necessary or expedient for employees to take the vaccine. So they engaged their lawyers and got them to look again at the contract of employment of their employees and to consider redrafting those contracts and giving new contracts for the 400-strong employee of the organization. So my question is, what is the nature of the status of this subsequent contract, which now includes clauses that would constrain the employees to be vaccinated or lose their job, as the case may be? What's the nature of this contract? What should be the status of this contract? And this contract value? Can we have your buy-in on this, Olumide?
So thank you once again, Robert. So I think it won't be a one cap fits all. First of all, in this circumstance, there will be existing contracts. So are they altering the contracts? Are they having addendum? Are they having another contract entirely? Or are they trying to smuggle in clauses that were not in the initial contract? So even if in situations where an employee is seen to have signed such contracts, sometimes one would have to look at it very well to see whether the employee was actually induced or forced into entering, because there are so many contracts that employees sign today. I've seen a couple where after an employee has worked for a while, then the employer brings a contract talking about the inventions that the employees made during the course of their employment, or some other clauses that they want the employees to be bound by. So sometimes the court will have to look at it very well to see whether truly the employee's consent to sign such a contract was actually induced or coerced. Because if you tell me that if I don't sign, I would lose my job, then that is not a contract. That is just some compulsion for me to agree to a certain policy. So that's why I said in every case you would have to look at the circumstances. But in this case, for an employee that has openly said that he or she is not willing to be vaccinated, then you come up with a policy for all employees to sign. That's still some form of compulsion. And I think such contracts or such agreements will be vitiated by absence of voluntariness in terms of consent. So I think, like I said earlier, it's not a cap-fit-all. For some organizations, yes, you see some employees that will willingly, for example, the HR director or the HR manager that brings such a policy might willingly sign. Or the director who wants to actually be vaccinated might willingly sign. So you would say that you want to use one hand to set aside all those contracts. For some employees, it might be truly voluntary. For some, it might be compelled. And the company that tried it in the UK, I'm so sure will be facing its own troubles now, because you really can't enforce such contracts if employees were compelled.
Thank you, Olumide. Thank you very, very much. So quickly, before we take the question, I have a very, very pressing question to ask Professor Prof. Now, are the current approved vaccines effective against new and emerging variants of the COVID-19 virus?
Sorry, say that again, please. I didn't get that.
Are the current approved vaccines effective against new and emerging variants of the COVID virus?
Well, that is still cast over that. There's no clear-cut information, but the new India variant that came up early this year, it says some of the vaccine in the US, the Moderna and Pfizer is quite effective against it. But for the AstraZeneca, I don't have facts on that. And that's one of the major challenges with the COVID-19 vaccine, because COVID-19 disease itself, because new variants of the viruses are coming up. And just to quickly mention here that there's a lot we don't know. Like I said earlier on, this is the worst public health emergency in the last 100 years. And the truth about it is that the scientists all over the world and public health agency has to keep trying to see what we can do to stem this pandemic. We've been very lucky in Africa. You agree with me that last year there was a prediction that we'll be carrying dead bodies on the streets of Africa. And there'll be a lot of hypotheses as to why that did not become reality. So I think we've been very lucky, and that we have mostly mild diseases. But some of them, just to be specific, some of these vaccines are shown to be effective, or some of these new variants of the virus. But we hope that, I'm sure as time goes on, we have newer information or new information about this, and we'll be able to inform the public adequately. Thank you.
Thank you very, very much. So just to take a few questions, we have a number of questions here from participants. We have a question from Lawrence Chinedu. He says, nice presentation from our panelists out there. My question is, what are the health agencies put in place to distribute the vaccine across the country? And which ones are for occupational health? I believe that question is so Adedayo. Professor Oladide.
Is that for me?
Yes, I believe so.
Okay. Dr. Oladide, yes. Like I mentioned during my presentation, the rich countries have better access to COVID-19 vaccine. What we have in Nigeria was donated by COVAX, and the dose that we receive could only carry about less than 1% of the population. So that's why the National Primary Care Development Agency has prioritized the frontline medical workers and the older people more than 65 years to be the first recipient. So, and that is what is currently going on. I'm sure by the time Nigeria has more doses or we are able to muster enough finance to procure our own vaccine, then it will become more widely available to people in the community. But as it's well now, we're only working on what was given to us, which cannot even take everyone. I had my second jab today of the AstraZeneca vaccine. And what we got to know is those who have not received the first jab cannot collect the second jab until they have new supply. So the issue is issue of supply. And what affects supply, if COVAX give us more, or if we're able to muster money as a nation to procure our own vaccine, because we have not invested enough resources to develop our own vaccine at the beginning of the pandemic. Thank you.
Thank you very, very much, Prof. The next question, I believe this is directed to Mr. Chuma. Somebody is asking here, is it discrimination to give incentives to an employee who has been vaccinated, but not to one who hasn't been vaccinated?
I think discrimination would be a big word, but I would address the question differently. But first on discrimination, there are basic ILO guidelines that guide what discrimination is, and they will usually revolve around things like gender. If somebody is deprived of a right because of gender, because of nationality, because of religion, because of political ideology, and all those kind of things. So let's set that apart. However, in terms of fairness in your compensation and rewards, it would not be the right practice to segregate your employees or your workers on the basis of those who have taken vaccines or not when administering your compensation programs. But I would think that in terms of encouraging, like one of the examples I shared at the beginning, if you recall, if you have a copay for your health medical arrangements and you opt to encourage people to take the vaccine by making some part of their co-payments, I think that might be acceptable as a practice. It's just an incentive, and incentives are allowed. Incentives are not normally given to everybody. The variable incentives that are based on productivity or to encourage certain kinds of behavior. So if this comes within that scope, it should be fine to do. But if for no just cause, for no reason, you're not encouraging productivity or to influence certain kind of behavior, you just administer compensation, and people could say that it's on the basis of all those lines that I have mentioned already, age, gender, religion, then that would easily fit into discrimination.
Just two more questions to go. Thank you very, very much, Mr. Chuma. Two more questions to go. I believe these questions perhaps are directed to the lawyers in the panel. Someone is saying here, can I sue my employer if I am dismissed from work because I refuse to take the vaccine? I would not throw this question to Remedy because I know that he would definitely say he will sue. So I would rather that I have maybe take this question.
Okay, so I'm going to before I respond, I want to piggyback on what the professor had said. We received 4 million, that's all we received, 4 million doses of the vaccine in March from COVAX. So that 4 million is actually for 2 million people, because you have to take dose 1 and dose 2. And then there's a hierarchy of need, right? Health workers, old people. So just laying the foundation. So I'm neither a health worker, I'm assuming, nor an old person. The vaccine doesn't go around. My question to this employer, and I hope I'm not the one, is what are you going to say in court? How are you going to justify sacking this person One, for vaccine that is not even available. Let's start from there. Then secondly, there's a priority of those that it's important we vaccinate this because all of the findings show that those who are most at risk are these people. I don't know this employer has a leg to stand on, is what I'm going to say. They're going to have a really bad case in court, just even on the facts of the case, because you can't enforce it. And there is no obligation to take it. And then, as Mr. Chuma has said, this virus, we don't know where you get it from. In the market, at home, you don't know. Nobody knows where this virus is gotten from. So as long as this employee is following the guidelines that has been approved, I'm not quite sure how the employer will say, because you haven't taken this vaccine, I will sack you. I would never advise an employer to do that. And if I was the employer, I'll try my luck.
I see Olumide smiling and nodding with so much encouragement. Thank you very, very much. So this last question, Olumide, could you help us give traction to this? Victor Chukuma is saying, how do we juxtapose the right to privacy with public health? Rights of others as envisaged under the Constitution. But basically, I think the question is, how do we juxtapose the right of privacy with public health rights?
Okay, thank you very much. Before I answer that, I'd like to go back to what Mr. Chuma said. So the thing about COVID-19 is a very sensitive issue that all of us nobody expected it. So even the scientists are not finding it funny. They are trying to find solutions. The same way with lawyers. So questions will always arise around COVID-19, and you quickly have to run to your statute books to see what answers you can give or what legal opinions you can give. So you said something about the person that asked the question on discrimination, that discrimination is only about sex, race, and everything. But these things are very technical. Now, I'll give you an example, and it's a very practical one. I know some pastors, they have told their congregation members not to, first of all, not to wear masks or not to be afraid of COVID, that COVID is not their portion, COVID cannot kill them. Some have even said their church members should not take vaccine. There's a case of a Jehovah's Witness man that wasn't going to take blood transfusion. That's their religion. They have beliefs. So people whose pastors and general overseers have told them not to take vaccine, some people have the tendency, the way we take religion in Nigeria, with respect to everybody, I'm a Christian, the way we take it, you might, I know some churches that were not eating some certain animals that they've been termed unclean. So any congregation member of that church would not take it because he sees it as sin. And if I tell you that in my religion, in my denomination, my GO said I should not take vaccine. If I take, I will not go to heaven. Because of that, you will now begin to discriminate and not give me incentives. Then I can hide under that section. I'm just trying to tell you the technicality and the multifaceted issues that might always come out of these vaccine issues. The way some people easily take it. Some people don't even take injections. They will prefer to take drugs. So you now ask them to come and take jab. They might struggle with it. So it's bigger than the way we see it. Because these things are personal. What you find easy, what you find comfortable, I may not find it comfortable. Now the second question that has to be section 45. This reminds me of the conversation I had with my friend Mayo Arugudari in one of the platforms. Section 45 has not really been litigated, but it's been interpreted on the surface. Section 45 talks about law. It doesn't just talk about public morality or public health. It says laws that have to do with public health. So there has to be, first of all, there has to be a law. So bringing privacy with public health, that's not what the question should be. It should rather be privacy with a law on public health. So until we have a law that says people must take vaccine, that is when section 45 will come into play. And I've also argued it on that platform that section 45 talks about law, not an act. It is arguable, I understand it is arguable. But if you look at section 318 of the Constitution, it defines law as an enactment of the House of Assembly. So the federal government does not even have a say here. If we are going by this, our Constitution, which everybody has said it is jaundiced, we all know our Constitution has problem. But the way the Constitution is now, in my modest understanding, That law there has to do with the laws of the state houses of assembly, not even the National Assembly. You have to go and look at Section 318 that interprets what a law is. So we can't be talking about the federal government compelling us or an employee, an employer. An employer cannot even make a law. So until the state's House of Assemblies, until they begin to make laws, that we cannot begin to activate under Section 45. It's a very, very arguable section. I agree. Maybe you can bring it within some other context. But the way it is, it might not really be useful to the National Assembly. So it is not just privacy and public health. It is privacy and a law on public health. And it's not just public health at large. Public health that has to do with mandate or compulsion to take vaccine. I'm still waiting for the first country in the world. Maybe we'll now begin to take a cue from such a country that will legislate the compulsion of the vaccine that everybody is not still sure about. Just like the prof said, it is still in the clinical stages. Nobody is sure. We are taking it. We have taken first jab. Some people will take second jab, they will see. Maybe after second jab, they will not wear face mask again, but we know we'll still keep wearing it. So we are all just going through it until we are able to find a lasting solution. But I agree with you. It has brought down the level of people who have been infected in some countries, in America, in the UK. But I don't think we have gotten to the stage where we begin to compare the vaccines. Thank you very much for the invitation.
Thank you very much for that elucidation. Unfortunately, I apologize. Because we've run out of time, we are not going to be able to take the other questions. I see quite a number. What we can do is that we will have some of the panelists respond to these questions, and then forward the answers to your emails. But at this point, we would like to end the conversation here. I'd like to hand over. First, I'd like to thank all the panelists. Thank you, Mr. Chuma. Quite an interesting perspective from your end. Olumide's very, very interesting table-shaking contributions here. And I quite enjoyed the fact that he had very, very strongly said here with all his chest that he has not taken and he does not intend to take. Mary, thank you very much for that.
I didn't say I would take it. I didn't say I would take it.
You said you have to travel. You have to travel. That is the caveat. Mary, I enjoyed your contributions very strong. They were very intelligent and quite fluid. Professor Oladele, thank you. But something that our participants are saying here, that they would like to have your paper. So we would appreciate if you can make your paper. I understand that it is very, very, very inciting and quite extensive. You dealt with a lot of the issues. It's very educating for most of our participants. We'd like to have them, so if you can make them available for onward forwarding to the participants. Thank you very, very much all. I quite enjoyed the deliberations. At this point, I'd like to hand you over to Onye. So please, over to you.
Wow, thank you so much, Rufai. Thank you, everyone. This has been a thoroughly informative session. Thank you to all our panelists and to all the attendees. Thank you for sticking with us till the end. I trust you gained a lot from this session as I did. One of the clearest things to me from this panel is that the answer to the question of whether an employer can insist that an employee takes the COVID-19 vaccine requires a lot of delicate balancing. For one thing, while it might be a win-win decision, as suggested by Dr. Laide, Mr. Wankwo emphasizes that there are actually no laws that empower the employer to insist that an employee takes the vaccine, and any insistence might put them afoul of human rights, cause them to violate human rights provisions. From another spectrum, Ms. Ekemezie is like, we need to be more deductive in our approach. If the main people at risk are elderly or health workers, then it can't cut across all workplaces. And also, a person should be allowed to take the personal risk of infection if they don't want to take the vaccine. This is a view that is echoed by Mr. Babalola, who is simply like, first, there aren't enough vaccines. Second, we don't know how safe these things are. And so let me live my life on my own terms. Regardless of where on the spectrum of this discussion you fall, I trust that the panel has given you a thorough overview of the facts and your rights in the workplace. Thank you once again to all the panelists. for a thorough exploration of this topic. Thank you, Wafai, for excellent moderation, as always. Thank you to the ELIR for the partnership and to all the audience. Thank you all once more and have a wonderful evening.
Thank you. Thank you. Thank you, everybody. Thank you. Have a very, very wonderful day.
Thank you. Bye-bye.